Good afternoon, everyone. You see the number is still slowly going up, but I'm just going to get started with some housekeeping while people join us. Great to have so many of you with us today. Thanks for taking the time out of your day to yeah, hear about our new research and the harms of wood burning. So um, today we've got a few different speakers for you. We've got the team from Ricardo here to talk about the new health modelling research that's quantifying the health impacts of air pollution for the first time in the UK. And we also have, we're joined by some people who'll be sharing their stories of the health harms of air pollution from wood burning. So it's going to be a really great hour, hopefully. Um, Please do put all your questions in the Q&A function. If you have any trouble finding that, let us know in the chat and we can direct you to it. But along the bottom of your screen, there should be a Q&A option. We'll be doing questions for Ricardo and for the Global Action Plan team at the end of the webinar. So please put questions in as you go and we'll get around to them at the end. If you do have any technical issues or you just want to say hello to everyone else in the webinar, the chat is there for you to engage with everyone else. We'll kick off. If we go to the next slide, please. Great. Yeah, so as I mentioned, I'm just going to quickly talk about the issue a little bit at the start and give everyone some context. And then we'll be moving swiftly on to Ricardo. He'll be talking you through this exciting new research, and then some short presentations on lived experience of the health harms of wood burning, and then I'll be back to wrap it up and tell you a little bit more about Clean Air Night 2026, which will be coming on the 22nd of January, and how you can get involved with this year's campaign. Next slide, please. Great. Yeah, so just to kick things off, we are recording this session. And so the recording will be available afterwards for anyone attending or who can't attend. But yeah, today we're really just focusing in on the health harms of domestic burning. So yeah, there's lots of reasons why domestic burning is an issue that we need to talk about. If we go on to the next slide. Yeah, so we're really focusing in on the health effects of domestic burning today, and Ricardo will be talking more about this, but it's one of the biggest sources of fine particle air pollution, which I'm sure lots of people know. And that fine particle air pollution is linked to heart and lung disease, to diabetes and dementia. So there's a really wide range of health conditions linked with air pollution from wood burning, affecting both people burning inside their homes and also people in surrounding communities. So Ricardo will talk a little bit more about that. But just so we have that context as well, there's other angles to this issue. So wood burning is also an environmental issue. So lighting fires in our homes produces more CO2 than oil or gas for the same amount of heat. So it's really not an efficient form of heating. And actually, it takes decades to reabsorb the carbon that's emitted in just moments when wood is burned. And given that we're in the middle of a climate crisis, we don't have the time for that carbon to be reabsorbed. So it's really important that we be finding greener solutions as well for heating our homes. And actually, there's confusing information out there about the cost of wood burning. And we've done some research with impact on urban health, and we found that it's almost always more expensive to heat your home with a wood burner than it is using central heating or heat pumps, unless you're collecting your own wood for free, which has lots of other risks in terms of using improperly dried or waste wood for your health. And ultimately, domestic burning is a social justice issue. So there's been a rise in the percentage of households who are burning, particularly in urban areas outside of our cities. So it's having a big impact on air pollution. And 92% of people who are burning are doing so as a secondary heat source. So they have another way to heat their home. And actually, it's a very small proportion of people who are burning, but those health effects are felt by everyone. So I hope that yeah is a useful kind of summary. But really, today we wanted to talk about how much of a problem domestic burning is for outdoor air pollution and what that means for public health. So I'm going to pass over to the team at Ricardo, who are going to talk to you a little bit more about how we're quantifying the health impacts of domestic burning.
Thanks, Chloe, and good afternoon, everyone. And thank you to the Global Action Plan team for inviting us to share our research on quantifying the health impacts of domestic burning in the UK. So I'm Tom Adams, a principal consultant specialising in air quality modelling at Ricardo. And joining me is my colleague, Jack Doobie, who is an economist and our health impact assessment lead. Next slide, please. So our study has two linked components. So we have an air quality modelling assessment, and this quantifies changes in emissions and ambient pollutant concentrations. And then we have a health impact assessment that converts those changes into health outcomes and the associated economic savings. So I'm first going to take you through the methodology and the key findings from the air quality assessment. So our study quantified the impacts of two mitigation scenarios targeting domestic combustion emissions across the UK. And to do this, we constructed a UK-wide air quality model, and this enabled us to both analyse the results in a national context and also provide results at a local authority level for Hertfordshire and each of its 10 district and borough councils. Next slide, please. So this slide summarises the key inputs and parameters that went into our air quality model. So we modelled emissions and concentrations of fine particulate matter, PM2.5, emissions of nitrogen oxides or NOx, and concentrations of nitrogen dioxide, so NO2. And these were modelled at a resolution of 1 kilometre across the UK. So our first task was to establish a baseline representing the emissions and ambient concentrations from domestic combustion in our baseline year of 2023. The domestic combustion emission maps were provided by Ricardo's inventory team, who manage the National Atmospheric Emissions Inventory on behalf of the UK government. So these inventory outputs are the most current and robust data available, and they provided the foundation for our estimates. So as mentioned, we tested two scenarios. So scenario one, this applies smoke control areas across all urban areas in the UK. So the map on the right shows Hertfordshire's urban areas in grey and the existing smoke control areas in orange. So for Hertfordshire, the additional controls would be introduced in the grey areas that are not currently overlaid with orange. So it's important to note that this scenario modelled partial compliance with smoke control legislation rather than full compliance. And this was in order to reflect realistic household behaviour that is observed when a smoke control area is implemented. Scenario two, so this assumes that all domestic burning that is not used as a household's primary heating source is stopped. So the difference between scenario one and scenario two could therefore be viewed as a comparison between what is possible under current legislation and what is possible with a significant change in mindset around domestic burning. Next slide, please. So I'll now give a short overview of the air quality modelling results before Jack puts them into health and economic context. So the table on the left summarises the estimated reductions in PM2.5 and NOx emissions for the two scenarios for the UK as a whole. And the maps on the right display the modelled changes in annual mean PM2.5 concentrations resulting from these reductions in emissions. So the results show that expanding smoke control areas to all urban areas in scenario 1 would cut around 14.5% of domestic combustion emissions and reduce almost 2.5% of the UK's total PM2.5 emissions. And eliminating all secondary, so non-primary domestic burning in scenario 2 would cut 73% of domestic combustion emissions and reduce nearly 12.5% of the UK's total PM2.5 emissions. So on the concentration maps, you can see that scenario 2 produces larger and more widespread reductions than scenario 1, reflecting that bigger emissions removal, and darker shading on the map shows where the largest local concentration reductions are for the scenarios. Next slide, please. So as mentioned, our model also provides results at a local authority scale. And when we applied it to Hertfordshire, and its 10 districts and boroughs, and we're pleased to see that Welwyn Hatfield is currently using these findings to inform their ongoing smoke control area consultation. And it's great to see the study's outcomes being actively applied to inform local policy there. So this slide contains the local results for PM2.5. So in the table, you can see that the percentage reductions in domestic combustion emissions by district follow a similar pattern to the UK-wide results, with scenario 2 producing larger reductions than scenario 1. The central image illustrates the district level changes in PM2.5 concentration for scenario 1, and the map on the right shows the scenario 2 improvements. So these maps help to illustrate where local public health benefits are greatest, and the spatial detail that the 1 kilometre model provides us. So I'll now hand over to Jack, who will explain how these emissions and concentration changes translate into health outcomes and economic savings. So over to you, Jack.
Yeah, thanks very much, Tom, and hi, everyone. Okay, to go to the next slide. Okay, so the objective of the health impact assessment was essentially to understand the impact on human health, and then subsequently what the economic impact of that would be. We're working with the same policy scenarios that Tom has just described, so looking at the implementation of smoke control areas and mitigating secondary burning. And our health assessment is essentially implemented based on the fact that those policies would be implemented in full by the baseline scenario that we're looking at. So we have looked at 2023, assuming full compliance. The assessment has been informed by the air quality modelling, which Tom has just gone through. Now, Tom sort of looked at the emissions and the subsequent concentrations and the expected changes, but we're interested here in the population-weighted mean concentrations, as our health assessment is focused on the change to human exposure. That's what we're interested in our assessment. And the main outputs from our study are a reduction in the health burden of air pollution. So I'll go through the health pathways that we assessed, the associated economic impact, so looking at the non-market disease burden, the healthcare costs, so that would be to the National Health Service, and also productivity. And these results were presented for each of the different scenarios and also for each of the 12 different geographies which we looked at. If we're okay to move to the next slide. Thanks very much. So I'll just give a very quick overview of the methodology, which I'll split into sort of 6 key steps. The first determined the scope of the study. So with the PM2.5 and NO2 concentrations, the scenarios, so we've already gone through those. The appraisal period was assuming sort of full implementation of those scenarios, but say so as an evaluation back in 2023. Understanding the population, so that's sort of key to understanding how it impacts human exposure, and the geographies as well. So the UK, Hertfordshire, and 10 districts within Hertfordshire. The second step was understanding human exposure. So this is sort of informed by the air quality modelling. So population weighting the concentration, so we can understand who lives in the areas where concentration reductions would be of highest relevance. Health risk association and selection. So determining the sort of baseline health data within those sorts of areas, understanding population risk rates, so we can understand better the sort of correlation between the reductions in pollutant concentration and the health impacts for those living in that area. Exposure risk relationships. So step 4. In the health impact assessment, this is primarily informed by concentration response functions. So each of the pathways we looked at has its own individual response function, which essentially determines the relationship between exposure and breathing in harmful pollutants and your human health. So this has all been taken from DEFRA guidance. We're following something called the impact pathway approach, which sets out different concentration response functions, sort of some variance between these functions to account for sensitivity analyses. The next step was the impact analysis. So essentially applying the data that we've collected, so the change in air quality concentrations, the risk rates, the population, and their baseline health data, applying these concentration response functions to understand, okay, what would the direct impact be upon the health pathways which we're looking at? And this has been determined in terms of statistical deaths, cases of morbidity and changes in hospital admissions. And the final step is the monetization. So understanding how the change in health impacts actually corresponds to economic values. If we're okay to move to the next slide. So before I go into the sort of findings themselves, I think it's quite important to just go through some of the key metrics which we're looking at and provide a little bit of description there. So the top one is looking at deaths avoided. It's a mortality indicator, which is looking at statistical deaths. Now, this essentially represents the number of deaths which could be attributed to air pollution at a point in time. And also, if we look at deaths avoided, how those deaths could cease. I think it's important to note here that this is a statistical based estimate. So this isn't essentially saying that all those deaths would cease, but it is saying that air pollution is a risk factor here, and that these sort of number of deaths can be attributed in part to air pollution. It's also important, I think, to note that it's not sort of a direct correlation between number of deaths, but this is sort of the aggregated total societal impact over the time period that we're looking at. The next one is looking at years of life loss. So this essentially is a measure of the number of actual years which have been lost as a result of premature death. So it's linked to the statistical deaths metric above. Quality or disability adjusted life years, which is a measure of not only the quantity of life years, which the above two are, but also the quality of those life years. So looking at what the morbidity impacts would be and your actual quality of life, and one quality would equal a 1 year lived in life in perfect health. The morbidity impacts, which we looked at, so we looked at cases of various sorts of health conditions, so asthma, diabetes, cardiovascular disease were a few of the key ones, and then also specifically hospital admissions, so linked to respiratory and cardiovascular. There were 3 key economic indicators, so the first one being non-market disease burden. Now, this is a bit of an abstract economic term, but essentially it's a societal impact which looks to place an economic value on people's willingness to pay for their own well-being. So it's not a direct cost in a sense, but it is sort of a valuation based on people's value of their own health. Healthcare costs, which is more directly linked to the National Health Service. So this is split into impacts upon primary, secondary care, and also medicine costs. And finally, productivity. So these are economic costs linked to people's ability to work. And essentially the logic here is the healthier people are, the better positioned they are to be able to work, the more productive they are. If we're okay to move to the next slide. So this slide presents the summary health impacts linked to PM2.5 and NO2 from domestic combustion only. Here we can see on the left-hand side the UK totals, and then as we go through the columns, you can sort of see the split per the different geographic areas. And we can see at the top, life year lost from deaths linked to domestic combustion being approximately 27,000, which equates to approximately 2,500 statistical deaths. Key other pathways were cases of diabetes, cases of asthma, and we're looking at sort of over 2,000 respiratory and cardiovascular hospital admissions linked to domestic combustion within the UK. we can sort of see there's impacts across all of the geographic areas which we looked at. If we're okay to move to the next slide. So here's an overview of the impact upon the UK. So we can sort of see a comparison between the two different policy scenarios. So smoke control areas, scenario 1, and scenario 2 being the secondary burning. In terms of life years gained, we can sort of see, close to 3,500 life years are expected to be gained under the smoke control scenario, and up to 16,000 as a result of reduction in secondary burning. This equates to over 300 deaths under scenario 1 and approximately 1,500 under scenario 2. At the bottom, we have the monetary savings or the economic impacts. The non-market disease burdens, very sort of significant value here. As I sort of noted, this isn't such a tangible impact, but this is, more a societal impact based on people's preferences. We can sort of see up to, 1.9 billion under scenario 2. But figures which are probably more relevant to this sort of context is the healthcare cost, so the cost of the NHS. So we sort of see linked to scenario 1, up to 11.5 million could be saved as a result of the smoke control areas, and over 54 million through the reduction in secondary burning. Productivity impacts also very significant under both scenarios. So close to 35 million under scenario 1 and 164 million under scenario where secondary burning ceases. I won't go through all the different mobility impacts, but within the report, these are also all listed for the UK and also for each of the geographies we looked at. If we're okay to move to the next slide. So this is just an overview. As we can see, all the different geographic areas you can see are impacted by scenario 1. We sort of see quite significant reductions in the Hertfordshire area in terms of up to 7 statistical deaths and 77 life years gained. But each of the individual districts can expect some benefit too. There are some zero here by some of their specific health pathways. That's due to rounding. That's not essentially relates to 0 cases. But it doesn't equate to one full case either. But very significant impacts across the UK, less so across some of the individual boroughs. But in terms of life years gained, we can sort of see, up to 77 for Hertfordshire, 15 for St Albans as the next two highest. If we can move to the next slide, please. But much more significant impacts under scenario 2 than scenario 1. So we've already discussed these at UK level, but even within Hertfordshire, we can see up to 28 statistical deaths saved, 300 life years gained. But even at the district level, we can see some quite significant impacts here. So in terms of quality adjusted life years, so a life year lived in perfect health, we can see over 500 in Hertfordshire, but also 70 in St Albans, 63 in Dacorum, 57 in East Hertfordshire. There's quite significant impacts from the cessation of secondary burning in all areas. Within the report, we've also provided these in terms of economic impacts too. So each district area has sort of its own slide, its own analysis, where we break down not only the health impacts, but also look at this in terms of the impact of the NHS and productivity too. And I'm aware I'm super over time, so I'm really trying to rush through. So I've only got one more slide left. It's just to sum up, essentially just to say, the implementation of both scenarios can be expected to lead to quite significant impacts, and that these impacts can be felt not only at the UK level, but also at the Hertfordshire level and the individual district level, but quite more significant impacts associated with scenario 2, the cessation of secondary burning, than the implementation of the smoke control areas. All of these impacts have associated economic savings, so quite significant savings linked to the NHS, but also productivity too. And then I suppose just some, thoughts on the assessment itself. This was really just a benefit assessment, so we didn't look into the costs associated with implementing these policies or scenarios. So if secondary burning was to stop, what the substitution be, were the enforcement costs linked to the smoke control areas. So sort of more in-depth cost benefit analysis would probably be needed to look into those impacts. But then also to say that this was looking at sort of like ambient outdoor air pollutant concentration. So we didn't account for indoor pollution either. So actually in reality, the impacts are probably higher than this assessment has set out. So I think that's also something, definitely worth pointing out. Sorry I've gone so far over time. I think I've gone way over double was allocated, but I'll leave it there.
Thank you so much, Jack and Tom, for that really thorough look at the data. I'm sure lots of people will have questions for you. I'm seeing some coming into the Q&A. We're going to get to those at the end. So if you do have questions for the Ricardo team about the research, do keep popping those in the chat, and we'll come back to those at the end. But for now, to put this in context at kind of an individual level, I'm going to pass over to Jack, who is going to talk a little bit about his experience of domestic burning and his health. So over to you, Jack.
Hi. To tell you sort of my experience with wood burning, my grandfather kept a wood burner, one that was burning no matter the weather, day and night. And he lived in a very small, like almost box room at the side of my grandparents' house, my aunt's house, sorry. And every time we'd go and visit him, because he wasn't particularly mobile, we'd all have to huddle into that room and have our conversations there. And he unfortunately passed away from a battle with multiple cancers and dementia. And I don't doubt that the environment he was living in helped him whatsoever. But personally, I can only compare like being in that room, being like as if someone had just been chain smoking in there before you. It was so stuffy. It was very heavy on the chest. And personally, I was quite lucky that I sort of only experienced like an unpleasant, uncomfortable feeling with being in there. My brother, on the other hand, he has quite bad asthma, and we could always sort of see that he had like his worst attacks the nights after. There were instances where he would have to go to hospital because he physically couldn't breathe. Um, but yeah, it was just so heavy, so stuffy in there, and that was on top of he had that on top of the fact that there was heating in that room. It was just kind of a tradition for him. He'd always had one. He'd always kept one. And I think my parents who grew up with it saw no problem with it, but we could really feel the difference in our breathing and just our general health when we were in that room. And it would last after we'd left as well.
Thank you, Jack, for sharing that. Is there anything that you'd like to say to anyone who has got a wood burning stove or is thinking about getting one, or just anything that you'd like to see done? There's a lot of local authorities and on this call, so anything that you want to see kind of local and national decision makers doing to help tackle the health impacts.
I feel like it seems to be such a kind of antiquated system and it's the most obviously harmful. So I think just pushing and incentivizing for more healthy, more green alternatives is the way forward.
Thank you so much, Jack. I'm sure everyone really appreciated hearing your story.
Thank you for taking the time
Thanks
to
for
listen
sharing
to
it
me.
with us. Yeah, so it's been I hope everyone's found it really useful to hear first from the data in terms of impacts at a public health level, and then also just to hear on an individual level what some of these impacts might look like. We know obviously those numbers, yeah, that air pollution for domestic burning is having an impact and contributing to ill health and premature death across the country, across the UK. So really sobering research and really hopefully powerful to help with our campaigning. Um, hoping that off the back of that, lots of people feel motivated to do something about this. I know lots of great work's already happening. And so we have Clean Air Night coming back in January on the 22nd. And we'd really love for as many of you as possible to get involved with this year's campaign. So I just wanted to talk to you a little bit about this year's campaign and what we're planning to do and how you can crucially get involved. Next slide, please. Great. Yeah, so the good news is that the public awareness of the air pollution health impacts of domestic burning is growing. So from our polling, we can see that around half of UK citizens surveyed are now concerned about the impact of air pollution on their health, and a similar number are concerned about the contribution of wood burning to air pollution. And those numbers are much higher in our urban areas, in our capital as well. So it's really great to see that the work of the sector to be raising awareness about this issue is working. There is growing awareness, but there's still a way to go. Next slide, please. We also see as a result growing support for policy intervention, particularly in London. So in our last poll, we saw that around 43% of people across the UK surveyed would support the introduction of a smoke control area in their local area. And around 35% of people supported the phase out of wood burning overall in their local area as well across the UK. And then in London, we see that it's around half of people would support a smoke control area or a complete phase out of wood burning in their local area. So not insignificant numbers of people supporting this change. And actually, really crucially, we see that when people have the facts, they're much more likely to support policy interventions. So 92% of people who are aware of Clean Air Night support at least one measure to tackle air pollution from wood burning in their local area. So it really shows that when people do have the information, they're really keen to see action from this at a local and national level. However, it is a little bit too soon to be concluding whether this is having a lasting impact on people's behaviour. So as we've seen in wider research, there's been a rise in the percentage of homes with wood burners since 2022. So really, this is still a growing trend, and there's not data to suggest it's really on its way down yet. So we do really need to keep raising awareness and also shifting those social norms to make sure that everyone can breathe safer air in their communities. Next slide, please. So with Clean Air Night this January, we're going to be continuing to raise awareness of the health harms of wood burning in the lead up to Clean Air Night and on the day itself. So this research we put out with Ricardo in Hertfordshire is the first step in that, really, and it was great to see that being shared far and wide and being covered in the likes of ITV and The Guardian. So great that conversation's already started. We're going to keep having that conversation, and we'd really appreciate as much support in that as possible to make sure that the public is getting consistent messages across the burning season about the health harms of wood burning. On top of that, we're also working to engage key influencers with this issue. So we're really seeing great results in terms of person-to-person sharing of these harms, but actually, how can we take these conversations from that individual level up to a bigger level and reach people who are not necessarily engaging with air quality information regularly. So we're working to engage journalists and politicians and key influencers across the sector, whether that be health experts or lifestyle trend influencers on social media, to amplify this message and help to minimize the promotion of burning in society. And then finally, as we've heard from Jack, there's a lot of power in these individual stories. So we're really hoping to platform the stories of positive change this year. So we've been working with a range of people who have experience of the health harms of air pollution from wood burning, who might have burnt themselves or might have been living in an area with lots of wood burning, and they're really keen to talk about their impacts, and we'd appreciate your help to amplify those stories. Next slide, please. So how can you get involved? There's a few ways you can get involved this year. There'll be a comms pack, as with previous years, that you can use to share the facts with your audience. And that this year, really excitingly, does also have these lived experience stories in it. So you'll be able to not only share the facts with your audience, but also really relatable examples of how this has been impacting individuals in their daily lives. We'd also really appreciate your help engaging with your local community and decision makers. So taking the resources in the comms pack and the FAQs that we have on our website, you could potentially put on an event, for example, for your local community, or speak to us, and we'd be really happy to help you find ways to connect your local decision makers up with this issue as well. It'd be really great to hear about your plans. So if people feel comfortable and have plans to share, please do pop in the chat anything that you or your organisation has planned for Clean Air Night this year. We'd really love to hear about it. And also you can email us on cleanerair@globalactionplan.org.uk. One of my colleagues will put that email in the chat now. But please do let us know. We love to hear about everything everyone has planned, and we'd love to amplify your work. And I could just see a question in the chat as well about when the comms pack will be released. Pleased to say the comms pack will be released in the next few days. So if you go to the next slide, please. Yeah, there's a QR code here to sign up to our newsletter. We're going to be launching that comms pack in the next few days, and that will be going to people on our newsletter list first. So if you do want to be notified when that comms pack is made live, please follow the link in the chat or on the slide to sign up for that newsletter now. Great. Next slide, please. Thank you. Yeah, so we're going to move on to questions now. Please keep putting stuff in the Q&A, but I'll start. There's a few here for Ricardo. Great. So there's a couple of questions on the modeling itself. So we've had a question as to what model was used for the atmospheric dispersion / chemistry calculations, and also were there any considerations of possible different meteorological dependence of the temporal variation of secondary burning versus primary heating emissions?
Yeah, so thanks for those questions, Christina. So just as a bit of background, so the weather or met data is used to convert emissions into concentrations in the air dispersion model, and we used one set of real weather data centered around one location in the UK, and it was recorded over the course of our baseline year, so 2023. And we selected a site that was in line with what's historically been used for the DEFRA pollution climate mapping, which you may be aware of. And we applied the same weather data to each scenario. So we're treating each scenario the same. And in terms of what model that we used Ricardo's rapid air model, so all one word if you want to search for that, and that's based on the widely used air mod dispersion model that you may have heard of.
Thanks, Tom. And we've also had a question around the kind of acute versus chronic effects of solid fuel burning. So yeah, question kind of saying, presumably domestic solid fuel burning contributes to PM increases across November to March, with little to none the rest of the year. So kind of suggesting that health effects might therefore be more likely to be from acute exposure in the winter period or exacerbated by other winter effects. So the question really wants to know, does the modelling find that there were particular periods of concern or no real changes across the year?
Yeah, really good question, Matthew. So essentially our results were annual mean emissions and concentrations. So we are looking at the impacts averaged across the full calendar year. So we don't have that seasonal detail in there, unfortunately. They're just averaged across the full 365 days. Jack, did you want to add anything around? I see Kerry's put a question in the chat around whether the statistics are per year as well. Did you want to clarify that point?
Yeah, so it depends on the health pathway. Some are sort of like chronic impact. So with all-cause mortality, for instance, which is most commonly linked to PM2.5. So that is sort of to do with long-term exposure. Some of the other health pathways, such as the hospital admissions, they're more to do with acute short-term exposure. So it sort of depends on which pathway you're looking at. But essentially, we were mainly focused on sort of like long-term chronic exposure.
Thanks, both. And then there's a question around smoke control areas, highlighting that there's quite a low number of prosecutions for smoke control areas that I think a lot of people on the call will be aware of. So the research suggests that these do have a small effect, though much less than scenario 2. How are those effects achieved if there are few prosecutions? Like how much monitoring and enforcement is there?
So in scenario 1, so that's the scenario where we modelled enforcing smoke control areas in all urban areas that didn't have one enforced. We tried to account for this by modelling it with partial compliance. So we used some previous research that has been published by DEFRA, which estimated or calculated the level of compliance as a result of the smoke control areas, and that's what we use to inform how much we reduce the emissions by in our models. So we're aware of that, and we tried to make our results for scenario 1 as realistic as possible.
Thanks, Tom. Great. And then just one more on the modelling then, and then we'll move on to something else. But there's how were the domestic burning estimates determined, and was there any sensitivity testing undertaken on the output model if these estimates were higher or lower than those determined? And is the data available at a local authority resolution?
Yeah, really good questions, Christopher. So we just took the domestic burning emissions straight from the National Atmospheric Emissions Inventory for the UK. So that's available online, and we just took the emissions as they are produced by the NAEI and used those. So we didn't do any sensitivity testing there. So it's a UK-wide model. So the air quality data, so the changes in concentrations and emissions, they have been modelled for the whole of the UK, and that's how we were able to drill down into Hertfordshire, if you like. The health and economics data, that requires further processing. So we've only done it for Hertfordshire in this case, but it's certainly some, as I say, the air quality model data is there, so it could be we could use the model to do the same for other areas of the UK.
Thanks, Tom. We've got a couple of questions more on the kind of campaign and policy side. So it's just a question as to whether the comms pack provides graphics that people can use. And yes, it absolutely does. So there'll be a range of graphics that you can use on social media, as well as the banners that we have on our backgrounds right now, and different assets that you can use to talk about the health harms of wood burning. So that'll be out in the next few days. So we've also got a question around the industry focusing a lot on the concept of a ban on wood burning and using that to kind of create anger and division. Yeah, there being a lot of focus on a ban on wood burning in social media and in the news. Is there any way of countering this by highlighting that it isn't just about banning wood burning, and that we're also trying to raise awareness to help the public make more informed choices? It's a great point. Yeah, we're really conscious with Clean Air Night that we're very much not calling for a ban on wood burning. We're calling for a range of different policies that would create the regulatory environment that would lend itself to voluntary behaviour change. So it really is about phasing this out, giving people options. So you can have a look at our policy pathway, which sets out a range of different policies that could be brought in to phase out secondary burning in our urban areas by 2030. And that's things like public awareness campaigns like Clean Air Night, health warning labels to kind of raise awareness, through to closing exemptions and loopholes in the current legislation around smoke control areas, and making sure local authorities have the power they need to enforce current legislation and take action in a way that's meaningful locally. So there's a lot that can be done, and there's a lot of policies that would help contribute to that. But really the aim is to make sure that everyone has the information they need to make more informed choices, and which lends itself, we see as people become more aware of the campaign, they are kind of intending to stop burning or burning less. So really the health message is a really strong motivator. Great. And then there's also a question about if there's a campaign to train GPs or doctors on how asthma and strokes, for example, are affected by wood burning or other sources of indoor air pollution. And yes, there's lots of work that the team at Global Action Plan are doing on training GPs. So we have things like online health modules that different doctors can take to learn more about air pollution. And we're really trying to engage health professionals through Clean Air Night as well, knowing that health professionals are really trusted messengers for the public. They have such a crucial role to play in making sure that everyone has the information they need to make choices for their health. So it's really important. And if you do have GPs in your local area who are interested, definitely do share this research with them, because it really helps them as well to have these tools to talk about the harms of wood burning. Thank you. And then, so there's a question on the modelling. How much of an impact on health would you have expected to see had you looked at indoor air pollution too?
So I think that the household and indoor air pollution is a really important issue, and it seems to be becoming more widely known and really important, especially based on the amount of time that people in the UK spend indoors each day. However, our report is looking at those emissions and concentrations outside of the home. So we haven't been able to quantify it here, but I definitely agree it's an important issue that should be included in the conversation around domestic burning, definitely.
Yeah, and I just add to that if I can. The tools and evidence, so quantifying indoor air pollution and human exposure are a lot less developed than it is for outdoor air pollution. So DEFRA's guidance and the impact pathway approach is much more focused on ambient air pollution than it is indoor air pollution. But it's becoming a more well-researched field. There are a few tools coming to the forefront now. The HAPIT tool, for instance, which we've begun looking into. So certainly you would expect to see quite significant health impacts linked to indoor air pollution. But yeah, the tools and the evidence isn't quite there on the quantifying stage at the moment. But I would expect that to change in the near future.
Thanks both. And then there's a question around if there's a plan to showcase these findings with medical professionals and the kind of media as well. So we have done some media around this report. So we launched it just at the end of last month, and we had coverage across different publications. It was the most read story in The Guardian that day, and it was also covered by ITV and BBC across different channels. So it was really great to see that making its way through to the public. And we had a great health professional, Dr. Abby Whitehouse, involved in that as well, talking about this issue. So we have been working with health professionals on this, and we would love to keep working with them. So if you are a health professional, or you know of any health professionals who are keen on this issue, we'd be really happy to chat to them about how we can amplify this message further. Great. I can see someone's put the link to the Guardian article in the chat as well, if anyone hasn't seen it and they'd like to. And then, yeah, we just got a question around the smoke control areas. Obviously, this report suggests that smoke control areas on their own aren't the solution. Perhaps they're not enough to tackle this problem. So, Tom, Jack, I mean, I'll come at it from policy angle, but first of all, did you want to speak a little bit to the difference between those two scenarios? Yeah.
Yeah, so it's so the statistics in the difference between the modelling showed we see a much more significant decrease in emissions and concentrations in scenario 2, so compared to scenario 1. And as I say, it's a comparison between what's achievable under current legislation, between the far greater decrease in emissions and concentrations that could be achieved by changing people's behaviour and attitude towards domestic burning.
Yeah, as what I just had from the health side, our assessment did indicate that there were benefits from either scenario. So, any action is worthwhile, even if it's not, 100% ideal, or it's not completely ceasing secondary burning. The implementation of smoke control areas will still lead to health benefits across the different districts across the UK, Hertfordshire, and still quite significant economic benefits too. But the more ambitious you are, the greater the health benefits are going to be. So I think that's probably the key message there.
Thanks, both. Yeah, from our side, it was really interesting to see that finding, and something that is perhaps unsurprising. Working in this sector, we all see that it's really challenging to enforce smoke control areas, and even if you are enforcing them perfectly, there's the eco-design stoves still exempt, and we know that homes with eco-design, even though eco-design wood burners are 3 times as polluted as homes without. So there is still a significant air quality problem associated with these newer wood burners. And so it's really interesting to see that kind of difference. And yeah, please do look at our policy pathway if you'd like to find out more about the kinds of policies that could be brought in. But to summarize, we really are calling for local authorities to have more powers. We know that local authorities are really keen to take more ambitious action on this issue, but there's a limit to what they can do within current legislation. So making sure local authorities have the power to tackle air pollution locally, and also closing the loophole around exemptions for DEFRA-approved stoves, which kind of confuses the messaging for the public, but also, as we can see, still creating an air pollution problem, even if smoke control areas were applied everywhere. And that all needs to be underpinned by national awareness. So making sure that things like Clean Air Night keep going, but also that we're getting clear messages from the national government on the health harms of air pollution from wood burning. Great. I think we've made it through all the questions, which is great. So I think we can start to wrap up. Thank you so much, everyone, for coming along, and hope it was really useful to hear more about the research. If you'd like to keep the conversation going, please do email us on cleaner@globalactionplan.org.uk. We'll be in touch soon with the recording and the comms pack and more ways you can get involved with the campaign. But we are also hosting another webinar later in the month around the business case for clean air as well. So one of my colleagues will put information about that in the chat right now. But if you're interested in another clean air related webinar, that's a great one to sign up for.